Workers' unions in the country want the Ministry of Health to cost the expenditure of the cash, which will be collected from Kenyans if the social health insurance bill becomes an act. The unions, which presented their memoranda before the Ministry of Health officials on the second day of public participation, also want more professionals employed to support in the running of health facilities for UHC to be a success. On his part, the Medical Services Principal Secretary, Kimutai, says the proposal to deduct 2.75% of salaries is not cast in stone and that there is room for amendments through the Public Participation Forum.
Of legislation that provides
for the second day running, the Ministry of Health officials held a public engagement with stakeholders to collect their views on the 4 bills proposed to spearhead the implementation of universal health coverage. Health Workers Union officials led by KMPDU, KUKO and Public Health, who appeared before the team, called for a proper cost of how universal health coverage will be delivered before the collection of the funds from Kenyans.
So we are planning to collect money, but we don't know how much. I'm planning to spend it. Try cost it, because if you look at the systems that work, they have an amount. They have costed what it will go to, and then you share it out also. When you share out the monies, because people have a tendency to take it to infrastructure, to brick and mortar, and to tenders.
The other concern by the unions is lack of enough personnel and other professionals to support health workers in level 2 and level 3 hospitals.
Managers are not empowered in terms of management of finance. How do we focus to ensure that there will be someone to support them, so that we do not accuse our people thereafter of mishandling finance, and yet they are not well trained, because they are trained to handle human beings.
My suggestion would be that we change from the sub-county medical officer to probably sub-county health officer, where anybody with experience and with capacity can actually be able to hold that responsibility.
Recommendations that Medical Services Principal Secretary Kimutai says will be considered as they engage with more stakeholders. Kimutai has also given an assurance that the contents of the draft bill are subject to change, including the proposal to deduct 2.75% of salaries.
There is nothing that is fixed, and that's why in law we provide for amendments. The proposed 2.75% is currently, but as you are saying, we are coming up with the legislations to bring everybody on board. And if you bring everybody on board, there's always you'll enjoy what's called economics of scale, because everybody is contributing.
On Thursday, the team is expected to meet with the Council of Governors, who will present their views on the Social Health Insurance Bill, Primary Healthcare Bill, Digital Health Bill, and Facility Improvement Financing Bill.